you everyone in the Netherlands at the amazing RAMSES conference in 2017 for allowing me to participate in your conference via remote and audio and visual technologies from the modern era of 2017 that allows us to communicate this way internationally. I'm sorry I couldn't be there. I want to thank Dr. C.J. Pericottle and Dr. Van Molken for inviting me to this conference and allowing me to participate. And the thing they asked me to talk about was medical media. And in the years past, we've discussed the importance of medical media, how to engage in it as a physician, and I thought today it'd be interesting to discuss it from another perspective of the person actually doing the interviewing and the anchors and the teams that look towards medical advice from medical experts to translate these complex topics to the people in the audience that may not be as medically savvy, and what makes a good medical contributor, what makes a good medical story, and some things not to do. So joining me today is a dear friend of mine, Bruce Hamilton, who's an anchor on the morning show at Channel 4 in Jacksonville, Florida. And I'm very fortunate to participate with on a regular basis as a medical contributor. So Bruce, thank you for joining us.
My pleasure.
Let me ask you, one of the first questions I wanted to kind of impart on our audience, why is it important for physicians to think about, especially in the modern era of social media, engaging in medical media, and what are some things that they should think about before starting?
A couple of salient points. Number one, education is key. People want to know. You mentioned social media. There is so much misinformation out there, and people will go to various websites. They may try and self-diagnose. But if you, as the experts, make yourself available to your local media, you're going to find that you really do make sure that the right information gets out there. And the bottom line is it can improve quality of life and in many cases even save lives.
Let me ask you, on the flip side of that, some people look at this as a great marketing tool, a great PR tool. How is that true, and how can it potentially be a very dangerous thing to do if that's your sole motivation for doing this?
Well, it is true, and the reality is that medicine has become business, and the business of medicine has changed the entire culture for doctors and their physicians' assistants and nurses and the people who happen to be in the office. It is very beneficial because what do you rely on to get the word out about your medical specialty and your expertise? Well, it's the recommendation of other doctors and the recommendation of patients. What's the biggest problem? If something is done to undermine that reputation. So the worst thing somebody can do is go out there and misrepresent or give misinformation, because all of a sudden their information is sullied, and then the business aspects of medicine can basically be ruined.
So the agenda has to be true and purely for the idea of educating our public about the correct medical information in an age where there's a lot of misinformation out there that's confusing for patients.
Absolutely, absolutely. I'm sure you've had patients who've come into the office and they said, I went to a particular website and I think I've got this. It's important to be an educated consumer, but people don't take everything into account. And I think that your job as a medical expert appearing on television, radio, or even granting a newspaper interview is basically the same as my job as a television news anchor. And that's to give the issue at hand context, perspective, and focus.
So from your perspective, when you interview a physician, what are some points that you take in and you're like, wow, this was a really good interview, this is someone that can do this well, versus some don'ts and things that actually make you a little bit more reserved to use this particular physician in the next round of topics that you may want to talk about, or the next opportunity to be in medical meeting?
Well, let me use a term that all people in the medical community are probably familiar with: bedside manner. If you don't have a good bedside manner, if you don't communicate with your patients and their families, and if you don't talk to them in ways they can understand, so many things can fall through the cracks. If people feel that you've got a grasp of the information, they understand that, we as the person who might be lying there in the hospital bed or going through a procedure isn't going to understand the medical jargon, but you boil it down to the salient points in language that we can all understand and go, yeah, I get that. You've really done a service for everybody. So adopting that bedside manner is probably the biggest do. Don't use medical terms, don't use a lot of jargon. Take your time and understand that part of being a good doctor is being a good listener. So put yourself in this case, the viewers or the radio listeners' hands or the newspaper's readers' hands, and realize that you want to get a message across. And it's got to be clear, it's got to be concise, and it's got to be to the point, and it's got to be relatable.
What are some points that you can give to our audience if they're thinking about or on the fence about whether or not to engage in medical media in their local communities? And what are some things they should really take to heart if they think that this may be something they want to do, but they really shouldn't because they may not be as well suited for it? How does someone navigate that conversation in their own mind?
Well, this is all about relationships, and it's understanding what you want and what you want to accomplish. The relationship part comes in if you reach out and you say, you know what, there was this study that came out in a particular journal, and I think there's a lot of misinformation out there, or people misunderstand, and I really want to do something to go ahead and clear the air and let people know what this is all about, because people are sitting back, and often they're frightened by what they hear in these studies. You know, again, let me go back to the context, perspective, and focus. If you think that you as the expert can make a difference in somebody's life, then absolutely do. If you're not comfortable with something that's outside of the medical realm and you can't boil it down and you're more clinical, then maybe it's best to have somebody else who's in your office go ahead and represent you, because the last thing you want to do is undermine your quote-unquote authority.
Now with this, what is a first step that you would tell to someone if they think, you know, I think I have the skill set, I want to engage in my local community through media, and I think I may be good at this. What is their first step to, one, try to engage, and then two, to reevaluate whether they're actually appropriate or good at what they're doing, and they're helping themselves and their patients and their community more than they're hurting them?
Let me take the Nike slogan, just do it. You know, if you're comfortable in your own skin, and again, if you think you're going to make a difference, go ahead and reach out to the members of the local media and say, hey, there's this study that came out. Or, you know what, I had this patient who had this situation, and I know that there are privacy rules. I don't know if they're the same all around the world. You can't name the patient, but you can talk about a particular patient's circumstances if you know that it's a problem that is fairly widespread. And you reach out to the member of the media, and you can do it either through a phone call, an email. You can have your marketing person do it and say, hey, there's this story that I think that your audience really needs to know about. And given what I do for a living, given my expertise, I'm the one to go ahead and deliver that message. And then there'll be a follow-up. You know, you'll talk to the producers, you may be talking to one of the reporters, and they're going to feel you out and try and figure out how you want to approach this. And from there, you just rock and roll, you just let it happen.
Final question. When you're looking at the ways to engage in media, you got print, you got the social media, you got the internet, and you got TV, radio. Now it's very easy to take a video camera and make a video and put it on Facebook. How do you make sure that you're careful about not doing something that can hurt you down the line if you want to pursue medical media and information a bit more broadly than that?
I remember my mom used to tell me, think before you speak, and it's really that simple. Whatever happens on media these days lives on in perpetuity. You know, long gone are the days of film and videotape that wound up, you know, being recycled or what have you. Everything that is live on air and is live on Facebook, live on Twitter, live on Instagram, or other, you know, social media mediums that you use is going to live on in perpetuity. So make sure that what you're doing is fair and accurate and really represents what you want to say. Maybe it's as simple as, you know, practicing in front of the mirror, or if you have a significant other or somebody in the office that you really trust and value their judgment, sit down with them and say, hey, this is my approach, run through this with me. It's almost like when you used to study in med school. You often had a partner. You bounced things off each other to make sure that you were on the right track. And this is really no different. It's all about you being comfortable and knowing what you want and what you want to deliver.
And to be honest with you, for everyone at RAMSES, experts in robotic microsurgery that are paving the way for an amazing application of an amazing tool, your expertise is profound. You want to be mindful of the process by which we have gained that expertise in robotic surgery is by looking at videos, is by doing the same thing over and over again. This is very much the same. I know through the years that I've been doing this, Bruce has been instrumental, and we're friends, so he can be very honest with me, and he always is. It's a very hurtful way. But
I'm gentle.
But it's true. I mean, you're not doing this well. You can do this better, and looking at tape and kind of seeing how you can talk. I have tendencies to use my hands that are much different than they used to be. I tended to ramble on, and Bruce would wave, you know, he'd nod my head. He'd rein me in. And so the relationship with the people that you're having these conversations with are very similar to the relationship you would have talking to your patients, and taking that information and learning from it and becoming a good medical correspondent or being a good medical contributor in the world where medical information is obtained in multiple different ways is profoundly important. And I think it soon will become a responsibility of physicians to be mindful of the information that's out there and make sure that our patients have the correct information and is presented in a way that's more education-based as opposed to a marketing advertorial based, because sometimes the expertise you get from being the person that gives them the correct information is much more profound than doing an advertisement.
Yeah, and you know, a couple of other points, if you really do want to get into the world of being a medical correspondent, when you sell your story, when you pitch your story to the various television, radio stations, or newspapers, make sure that you've got some supporting materials. You know, television is a newspaper with pictures, so have things that can help the viewer visualize what's going on. Maybe it's pictures of a procedure in which you say, hey, look, you know, you can see where this clot was, and by using this robotic surgery, it was in a very difficult spot. Before, we couldn't be as precise as we are now. You can see how the robotic arm and the computer that's used to drive it is making that procedure that much easier on the patient as well, and less invasive. Also, provide your reporters and your contacts with some bullet points. So you're the one who's actually guiding the conversation, and they can use those bullet points on the screen, again, to help the viewer and the person who's listening to you visualize what you're talking about, so you make sure that your most salient points get through.
And Bruce, I want to thank you for helping us navigate the world of the media from a physician's perspective. And for those of you in the audience, think about doing this. At RAMSES, everyone there are a group of surgeons who are blazing the trail for a technology and applying it in a completely different way. And your expertise may be profound to give information to patients that may not know that those opportunities and those procedures exist. So again, I want to thank everyone at RAMSES for allowing me to participate. I hope you find this helpful. If I can be of any help, please contact me, Ali Kasraeian, at mac.com. Join us on the conversation, our weekly radio show at WOKV.com and www.theconversationjacks.com. We're on Facebook, we're on Twitter. Anything I can do to help in this process, because it's important. I think it's important for us to take responsibility for medical information, because if we don't, Dr. Google is going to give a lot of information that may not be true and could potentially be dangerous for our patients.
And as far as the technique of actually doing some interviewing, I managed to grab some information off the internet, and Dr. Kasraeian actually has copies of all of these. It's, you know, some salient points like do keep your answers short, communicate your message, use first-hand examples and descriptions, use plain English, and make sure that you answer the question. And if you're not sure where you're going, pause before you answer. So if you'd like a list of these interviewing techniques, just email Ali, and I'm sure he can forward them to you.
Absolutely. We'll have those available. Thank you, everyone. I hope you have a wonderful time in the Netherlands, and I wish I could be there with you, and I look forward to seeing you around on the web and following us on Twitter and the Facebook page that we have. But anytime that anyone needs any help, please let me know how I can help, and I look forward to see you guys at RAMSES next year.
And I should have made him pay for me to be there live with you so that we could have a question and answer. Maybe next year.